Today I want to talk about our feces, our stool, our feces, because some people are coming to us. Frequently nowadays we are getting to ICU people, young men and elderly people also, with low hemoglobin. The patient is pale, his hemoglobin is 4 grams or 5 grams. He comes with breathlessness and sometimes with cardiac failure also, because severe breathlessness can lead to cardiac failure. So please be cautious about these things, and please, because he doesn't know, the patient doesn't know why he's pale, he has not seen. The main reason being, he is bleeding inside the intestines, and the bleeding is slowly coming down through the feces, through the motion. He doesn't know it. He just passing motion, he is not seeing it. He doesn't complain, but he's passing black motion. His passing motion is black in color for the last 3-4 months. For the last 3-4 months, his motion is black in color. That is not observing. Please, at least once in a week, try to observe what color your motion is and what is the consistency of your motion. That's very, very important. Stools to be examined. See, if it is black, it means to say that if it is black, tarry stools, black, tarry motion, black, tarry feces, it means it is given in our books. Whenever there is a bleeding from the stomach or from the intestines, large intestine or small intestine, and it is slowly joining the motion, the blood which comes out becomes black. The motion will be black in color. And one more thing is, it regularly, daily, and in the toilet basin, it sticks to the toilet basin. It doesn't go so easily. We have to use a brush for it. So this is what happens when your motion is black and you are bleeding inside your stomach or intestines. That should be taken. Say maybe some ulcers, or you need some. Suppose you already noticed it. You need to have an endoscopy or a colonoscopy. Gastroenterologist will take care of it. Number 2, the red. If the motion is painless, without pain, the motion the patient is passing motion, but there is some amount of blood in it, frank blood, red color blood. It means he must be having some piles. Okay, that is very, very important. Second one is, if the patient has got a painful motion, he is passing motion with pain, and some small amount of blood streak is there with the motion, it means to say that the patient has got an anal fissure. Anal fissure means a small cut in the anal area. So some bleed with pain, severe pain, it will be there. So please observe it. Number 3, pale. If the patient has got, usually the motion color is the feces color is yellow to brown. We all know it, yellow to brown. But in one condition, obstructive jaundice, where the bile from if the stools are pale, just examine your stool once in a week. If the stool is pale, usually the feces are brown or yellow in color, yellow to brown in color. But there is no yellow color, there is no brown color. It is pale, that is almost nearing white. It is pale in color. Pale in color, no yellow, no brown. It means slowly there is a chance of obstructed jaundice. Obstructive jaundice. Jaundice, there are varieties of jaundice, types of jaundice. In this obstructive jaundice, what happens is, the bile which is flowing down, the bile which is coming down from the liver, from the gallbladder to the intestine, is stopped because of some obstruction. It doesn't enter the intestine. There is one pigment called stercobilinogen in bile which doesn't enter the stool. That's why the stool is pale. So please see that, at least observe for once in a month. You just observe. That is not that important. And one more important factor is, how is the quantity? What is the quantity and texture of this feces? Is it bulky or less? If we are able to pass a bulky motion, a bulky feces without any struggle, you have an urgency in going to toilet, you go to it, you have a bulky stool, and the stool is full of fiber, because you will know about fiber. Once the motion comes down into once the feces go into the water, it breaks down into small, very tiny fibers, something like that. So it has got full of fiber, bulky stool which floats in water. which floats in water, and a fiber just moves around, and it means to say that your feces has got lot of fiber and gas. That's why it is that's why it is floating. It's a very good sign. That means to say that it doesn't just go out with a single flush. You may have to flush with a bucket of water, doesn't matter. Okay, only thing is you are very, very healthy, because you will not suffer in future. You are taking very good diet which is full of fiber, It is happening to me because I am taking millet diet completely. So now what happens is 9 to 12% fiber is there in millets. So what happens is you are passing bulky feces completely freed. At a time when you go to stool, your large intestine is totally becoming free, and you are passing a bulky stool which floats in water. And one more thing is it is full of gas. That means to say that you have healthy bacteria also inside. Gas means healthy bacteria. So please, if this is the thing, it is very good. It is very healthy, in fact. But if the stool is very less and you are with difficulty you are passing, and you just with a single flush it goes out, it means to say that there is no fiber in your diet. There is nothing about it. It is not dangerous, but you have no fiber in your diet. Fiber in the diet will take care of in future problems like cancer of the large intestine. Cancer of the large intestine you can prevent by using good fiber diet. These are the things I wanted to tell you. These are very, very important. Number one is black color, red color, pale stools, and bulky stools which float. It's very important.